Wandaling Kalupig. I'm the founder of Cancer Eclinic. I started the Cancer Eclinic last year because my mom, they took water from her lungs and immediately the doctor said in Canada, you have stage 4 lung cancer. I have people from all over the world to talk about both their experience and expertise, how to prevent, detect, cure, and cure cancer. So having that community support can really change lives. It's not been done before because it's such a big project. Because of the kind of work we will do, it's beyond medicine. It will change lives beyond level. I will say it will impact generations to come.
Hello, Wanda.
Hi, John. Thank you for having me. I'm super excited today.
I can see that. Finally, a kabayan. You know, you are representing a movement that is very, very close to you.
Thank you, John. I'm very excited. Honestly, this project is so personal to me.
Wanda, ikaw na ang susunod. Mabuhay ka and good luck.
Thank you, John. Do you know anyone who's diagnosed or lost their life to cancer? Thank you for raising your hand. I do, my mom. Let me tell you a quick story. Last year, my mom was diagnosed with stage 4 lung cancer. She died May 29, 2025. This is the problem with cancer care. Right now, there's no integrative holistic support to help the needs of every patient. This is why we're having the Cancer Eclinic compassionate, comprehensive support. So what are we going to do with the Cancer Eclinic? Well, we're going to have a dedicated cancer care team from the diagnosis to the recovery. What's going to happen here? We're going to match the patient and the provider because there's a lot of provider, but there's no one platform to find them. Now, we have not registered the company yet, but we do have partners already. We started last year. So Dr. Ramin Paredes is in the Philippines for over 20 years. He has helped 10,000 plus cancer patients through integrative healing. So he extends the life of patients. In the UAE, well, I have a partner, Dr. May Al-Shamsi is the first UAE National Integrative and Regenerative Doctor. Now, in terms of the revenue model, we, of course, want to have money first from the podcast sponsors. Last year, I started something called the Cancer Conversations with Coach Wanda. We want to partner to raise awareness with non-profit organizations too. Now, in terms of partnership, of course, commission basis is what will work. So we want to partner with laboratories, pharmaceutical companies, hospitals, healthcare. Coaches are very critical too for cancer patients and their families. Now, in terms of the patient of the family, from teleconsult, the concierge fees that we're going to charge with them, the healing retreats that we will co-facilitate with the doctors we're partnering with. Now, in terms of the ask, how much do we need? We want to ask $500,000. We want to develop the AI further. Of course, the medical and holistic is very critical to make this work. The marketing, of course, we need to do more than the podcast I'm doing right now. So first, let me share with you the AI care assistant. So laboratory so much, it's so difficult to understand. What it will do for you, you upload the lab report in 20 seconds. You get what it is about and what are the questions you should ask the doctor. And of course, the treatment plan is here, the personalized treatment plan from your cancer care team, and that's it. So now, my question for you today, I believe no one should fight cancer alone. Will you help us change that story?
Oh. You know, I just want to say something that cancer, especially nowadays, for whatever reason, I'm not a specialist, but it's growing rapidly.
Yeah, I personally lost my mom last year from cancer, and I wish we could have a platform that can connect me because I couldn't help her. She had a really rare cancer. My question to you, have you thought about choosing a country when it's a little bit faster to get started as a pilot?
Actually, Dr. Romy is our pilot partner.
But he's here.
But he's in the Philippines.
Listen, firstly, my condolences. I know you've lost your mother recently and that wouldn't have been easy. And for you to stand here and talk about it, bravo. I think what you need to understand is how strong is your AI algorithm? Is that your IP or is that a plugin from somewhere else?
That's a good question. This is why actually we needed the funding because we want to IP it. I mean, from a business perspective, the IP is very important.
The idea for me is if you can build that platform, now you can plug in suppliers from elsewhere rather than you trying to become the hospital, because a lot of what you were asking for out here was to try to become the caregiver itself.
No, I'm gonna integrate them.
That's my understanding.
I
No,
didn't.
but if you look at how you're looking to put in your money and investment, if you go back and see where you're asking for what,
It's a
Maybe I can
platform.
I know
make
it's
my
a-
perception of
yeah,
what
I'm
this
gonna
is.
go back to-
It's a pure
It's a
tech
platform.
platform
Yeah,
to
it's a-
connect people, to connect patient with doctors.
Yeah,
That's
we're-
it. And
We're not
caregiver.
replicating everything. I'm gonna connect
so for
everybody
me,
here.
I wouldn't need a medical and holistic team if I'm a platform. I wouldn't, my compliance
that?
or legal would.
But you need to
No, you
first
need to know
vet,
where the
because I'll tell you what
guide
happens. What I understood is the initial bridge is required to guide in which direction. So cancer,
Exactly.
like thousands of cancers.
Yeah.
So I need to vet and figure out, okay, she has this kind of cancer.
Filter.
What's your budget? I'm going to send you to that person.
Yeah.
Exactly.
That's why it's
That's the
needed.
concierge.
The initial filtration is what the soul of
Yeah.
this
Hey,
business
bravo.
is.
But
Well,
the filtration does not need to happen out of you trying to create. I mean, there's enough healthcare providers who just do the filtration.
That's what she's trying to solve. People
Yes.
don't
But
know
the
where to
difference
go.
between the healthcare provider here, there's no incentive. If you have a medical holistic team here that's driven just to find the most suitable solution for whatever case may exist from an affordability, then you're able to really ensure that that best option for the individual is there. And one of the biggest sources of anxiety for cancer patients and their family
They don't know where
is
to go.
uncertainty.
Exactly.
They don't know where to go. There's no time.
Exactly.
Imagine you suddenly have
Exactly.
this, available resource that is not biased, right? That you're not just fitting the medical need, the budgetary need, the lifestyle
Why does
implications,
that team have to be
diseases.
in-house? Why can't?
No,
because
she's
they're
not
not
saying
They're
teams.
not. They're
No.
consultants. So at 125
Yeah.
grand, you would assume that they're probably going to be all over the place for the. I would
connection.
assume you have to have a pretty large spread.
So, because
I mean,
what
they
I
charge a
like.
service fee. They charge a service fee
Yeah,
anyways. That's
what,
the
what,
service
what,
they're
what I
doing.
like, because
Yeah.
when you got cancer, and I know what I'm talking about,
Yeah.
the first thing is ignorance, because you don't know.
Exactly.
Okay, and after that, which is more dangerous, is illusion of knowledge.
Yes.
You think you know, you don't know.
Exactly.
So that's why your platform, I believe, is good
Exactly.
because it's gonna
To integrate,
connect
yeah.
experts with people who has
Who know.
illusion of knowledge and has ignorance.
Listen, I mean, no matter what are the results of the show, you're a winner for being here and trying to make a change.
Thank you so
Thank
much.
you.
Thank you.
Thank you.
Thank you. It was very difficult for me when I started. I felt like I'm gonna cry because my mom's picture was on the first page. Thankfully, I was able to hold through. I think I love what Lubna said, her experience, her journey. She understood exactly what I wanted to do. And I love also how Adel and Jigar gave their comments. Also Sammy, at the end, the Jigar had a question, but everybody's like, no, you didn't understand what she was trying to do here. So I love how the three of them understood what I was trying to do, and Jigar towards the end calmed down and get his questions answered.
I found this amazing idea, and I understand it has to be from business perspective rather than emotion perspective. Because the problem with cancer is the doctors, they don't talk to you. Is that you have like 15 minutes, talk to me, I already guide you, okay, thank you, bye-bye, pay and leave.
The biggest challenge what happens is that when you get it, and if it's an aggressive one, you don't have time.
I love the concept of creating that ecosystems, but what I was referring to and what I think needs to happen here is that how do you bring affordability
Yeah.
by creating that filtration system, but in
But
terms
this is
of
what I don't understand.
Yeah.
You're still talking about healthcare, where here we're talking about platform of connection, that's it.
No, but the question is, the whole platform of connection is based on an AI model, and like, what do you want to talk
So
about? Because do you know how
think-
easy that is? What
Yeah.
was shown here?
I would avoid the focus on the AI model because I do believe you're competing with the ChatGPTs of this
Yes,
world when you're
yes,
just putting in
yes.
the data and it's giving you true
Yeah,
insights
yeah.
on what can come out based
Yeah,
on
it's
millions
true.
of published reports. So where I think there's a real advantage here is you find a community that really needs help, right? People who
Yeah.
aren't aware, who need to know where to go, how can I afford it, and connect the dots for them in a way which is available. How do you ultimately create an accessible medical concierge.
But I don't want to see a ChatGPT report.
But but she didn't talk about ChatGPT. So
Yeah.
she said she has AI, but then she's going to have a team of people who's going to filter it. You're building this whole army of supply, and then tech and the people filter out, understand the issue, and then direct you to the right direction.
No, I mean, I think there are enough hospitals and micro ecosystems are surrounding cancers, right?
But you don't know which one to go to. That's what
Yeah.
they're solving.
So this business needs to create that hub.
So that's what it was
That's
about.
what she said.
Yeah,
The
but-
booking.com for the health.
But the AI needs to be about what's probability, right? But then
What's
that's where
available.
what's available,
Yeah.
what's the price point, and that's a matchmaking tool that AI can bring in. But yet the communication has to happen through that human.
It's a hybrid.
The one thing we all agree on is that was
It is
a
good.
worthy cause, and hats off to them.
Yeah, for
Yeah.
sure.